A New Mexico organization is utilizing some groundbreaking new methods to fight a deadly disease. For the past few years, certain patients at New Mexico Cancer Center have been taking part in clinical trials in which doctors use immunotherapy to turn on the body's natural defense systems to fight certain forms of breast cancer. Let's take a look at how it works.
I am Catherine Sanchez. I'm a medical oncologist and I specialize in breast cancer. At New Mexico Cancer Center, we treat many people on clinical trials. We opened a clinical trial a couple of years ago that gave people access to immunotherapy early. It was in a new cancer type that we don't use immunotherapy in, that kind of breast cancer. And for people who have advanced or aggressive disease, immunotherapy can be really important because it turns on the body's immune system to fight their cancer. So in this clinical trial, patients were treated with immunotherapy plus standard of care, but gave them early access, or the only access they would have to that medication in this type of cancer. And we got the results from that clinical trial in the last few months. And we showed that there are people who do better when you add that medication. We treated a number of patients on the clinical trial, and in fact, many of them were Native American or Hispanic. Those populations have just been left out of clinical trials, especially immunotherapy trials. They're 99% white. And so we learned from that clinical trial that patients benefited, but we also learned from that trial that Hispanic patients did not benefit as much as Caucasian women. So I think that it was the women who were treated on trial here did very well. Many of them got to a cure at a higher rate, but it also did help us to understand, or begin to understand, how the medications that we use may be different, or may actually work differently in patients who are minorities. What that means practically is we don't understand how our medications work for everybody. So I felt like women on that trial had early access, got the best care. That trial was open at Cedars-Sinai, at UT Southwestern, at Duke, and New Mexico. And I think those women were benefited. Actually, even a man with breast cancer benefited from that clinical trial. And we also learned something that was important for patients in New Mexico. Breast Cancer Awareness Month is October. And I just think as we're looking forward, breast cancer affects 1 in 8 women. In some communities, probably as much as 1 in 7. I'm so glad that we have equal access in New Mexico and really incredible care for women with breast cancer. But if more women got screened, we would cure more women. And so I think it's always really important to remind women that if you get your mammogram, it's the most important thing you can do. If we find something that's tiny, the cure rates for a stage 1A breast cancer are 97 to 99%. And I would rather see more women with stage 1 breast cancer than have to give a lot of treatment to get women to a cure. So I think that it's really important as we look out that we also talk about getting screened. It is really the most important thing someone can do. It should start at age 40, not age 50. And if you have a high risk in your family, it can start earlier. And also, it is usually continued until 65, but women are living beyond 65. And so it is something that should not stop because breast cancer becomes more common as we get older. I hope that if we screen better, we find cancer sooner and we end up at a cure. 1 in 8 means that that's 12% of the population, 1 in 8 women. And so I think it's just really important to really think about that as we head into Breast Cancer Awareness Month and every month.
A lot of important information right there. And for more information on the New Mexico Cancer Center and the work they do, head on over to krqe.com, click on that New Mexico Living tab. All right.